How many people do you think have sleep apnea in the world? Approximately 1 billion people worldwide have obstructive sleep apnea. At least 36 million people in the United States have sleep apnea. However, men and women do present differently when they have sleep apnea. Men often present with snoring, witnessed apnea, or they have a partner that's worried about their sleep. Most women present with insomnia, fragmented sleep, waking up with headaches, or feeling fatigued or depressed during the day, and they're not sure if they're depressed because they're sleepy or they're sleepy because they're depressed. Here's the catch. All of our tools that screen people for sleep apnea are really based on men's symptoms. For instance, the stop bang. That G at the end of the acronym stop bang stands for gender. If you're a woman, that effectively rules you out for sleep apnea, and we're missing tons of women who may have moderate or severe sleep apnea. In addition, mild sleep apnea can cause a lot of fragmentation of sleep, and that inevitably will affect your longevity and your ability to lead a quality life as we age. This is highlighted when a woman hits midlife and she begins to have changes in her estrogen and progesterone levels. This affects our ability to get in the right stages of sleep. It also affects our circadian rhythm. This then lends itself to that fragmentation of sleep, insomnia, and then we have structures at the back of our throat, that soft tissue that's keeping our airway open. Those structures are supported by progesterone and estrogen. Progesterone drives our ventilation, that drive to sleep, and estrogen helps to support the airway. When we have this change in hormones, and we don't have a gradual decline like men do, for women, we're declining, then all of a sudden we hit menopause and we've got this cliff that we fall off of for our hormone levels. And that greatly affects our ability to get to sleep, stay asleep, and for up to 50, in some studies, up to 65% of women who are in midlife will have sleep apnea and don't know that they have it. And that is a risk factor for heart attacks and strokes. When you have untreated moderate or severe sleep apnea, you have up to a 4-fold increased risk for having heart attacks and strokes, and up to a 6-fold increase in having a car accident. So lots of car accidents that are happening out there, they're probably due to being too sleepy. So what do we do about this? First of all, we've got to educate our clinicians. And why I'm doing this video today is to educate the general public, to bring agency and awareness so that when you go to your provider, you are armed with information if you're having some of these symptoms. Because sleep apnea can cause, again, heart attacks and strokes, and cardiovascular disease is the #1 killer of women. The best thing you can do is write down your symptoms and have an appointment scheduled specifically to talk about your sleep or lack thereof. Don't wait to roll it into a wellness exam or a well woman checkup. You want to spend enough time and give your provider enough time to really focus on your symptoms around sleep. At that point, that person will decide if they're a primary care provider or some other specialty. They will decide whether or not a sleep study is warranted or potentially a sleep medicine evaluation. For most women, I have a pretty low threshold for testing for sleep apnea because we don't have any great screening tools out there that capture the symptoms of women in midlife. And for men, we do have lots of screening tools, and I use those screening tools to help me identify who has a high pretest probability for sleep apnea. Now, if you have a sleep study and it is negative and it is a home sleep study that is called a type 3, then I do recommend, if you still have a lot of symptoms, to move forward with an in the sleep center sleep study. Now, there is an in-between study called a type 2 sleep study. It is done at home, but for all intents and purposes, it has the same type of connections that an in-lab sleep study has. I use that for women that I see because I think it does a really good job of capturing abnormal breathing, and it also gives me information on your sleep stages. If you have sleep apnea, how do we treat it? We treat it with forms of positive airway pressure, an oral appliance, sometimes positional therapy. There is surgery. There are also devices that can expand the palate to help you breathe more. And there is also the use of GLP-1s in patients who do meet that criteria. My advice to you is if you're having any of these symptoms, again, write them down and schedule an appointment that is dedicated to talk about your sleep. You don't want to suffer through having sleep apnea or any other sleep disorder, and you deserve to get good sleep.